Hello everyone, this is Dr. Bhavna Agarwal from Flawless Aesthetics. My clinic is here in Pink City of India, Jaipur. The purpose of making this video is to share my knowledge and skills that I have gathered over 19 years of exclusive aesthetic practice with the new millennial aesthetic doctors and injectors. In the previous video, we discussed the frontalis muscle function and action. And in this video, I will be sharing how the structure of the frontal bone has an impact on frontalis muscle function and action, and as injectors, why should we know about it and what can we do about it. From our knowledge of anatomy, we all know that the frontal bone has an anterior convexity, also called as frontal bossing, in the profile view. Now, this anterior convexity has a significant role to play in the resting brow position and also while the frontalis is contracting to have a brow lifting effect. As we age, certain changes are taking place in the forehead, and because of bone resorption, the frontal bossing or the area of convexities of the forehead gradually transform into the area of concavities, which can be appreciated as hollows over the eyebrows. And because of the supporting effect, because of the loss of this supporting effect of the frontal bone, there is flattening of the eyebrows, and also there is hooding of the skin over the upper eyelid. The next important thing that we should know as injectors is that the anterior convexity of this frontal bone acts as a lever to the frontalis muscle contraction. So the frontalis muscle, while contracting, glides over this anterior convexity, bringing about the brow lifting effect, and during which the overlying skin creases. So which means that most of the patients, most of the clients coming for Botox to us are in the age group of 30, 35 or above. And most of them would be having some age changes in the forehead because of bone resorption. That means that they would be having some degree of flattening of the eyebrows or upper eyelid hooding. Now, the reason for this is volume loss in the frontal bone, and the revolumization of the forehead comes as a very advanced procedure, and most of the times many individuals, many doctors are not doing it also. So the forehead again, treating this type of forehead becomes challenging again, because we do not want to aggravate the problem, and at the same time we want to give the solutions to the horizontal forehead lines. If someone is an experienced injector, they always have the option of revolumization of the forehead and treatment of the temporal hollows to give optimum results. But if you are a beginner or a novice injector, then the way to go about treating those horizontal forehead lines among all these existing challenges is to identify the challenges first, stay conservative and minimalistic, which means that restrict yourself to injecting in the middle of the forehead, only most of the upper half, and stay very superficial, use low dosages, try to avoid any potential complications like lid ptosis and brow ptosis. Also, in female patients, you could consider treating the outer upper superficial fibers of orbicularis oculi to give slight arch to the eyebrows, and also improve the hooding of the upper eyelid to an extent. So hope that was helpful, and stay tuned. Thank you for watching. In the coming videos, we will be discussing about, and we will be doing live injections over the clients to bring about more clarity to the procedure. So stay tuned, and thank you for watching.